The color of your urine can provide valuable insights beyond just the quantity of water you are consuming. Hello, I am Dr. Tiago and I am a urologist here in São Paulo. Today I want to tell you the story of a patient who recently came to see me, Pedro. Pedro is 52 years old and he arrived at this appointment with me approximately 3 months ago. Around 15 days prior to the appointment, he observed that his urine had a slightly reddish color. However, as he didn't experience any sensations, he didn't become concerned until he encountered a subsequent occurrence that was slightly more intense, during which he even expelled tiny fragments of coagulated blood, known as clots, which can be discharged when there is bleeding. He was not worried. He did not have major concerns regarding these symptoms, but he ended up reporting it to his wife. She, filled with worry, ended up scheduling her husband's appointment, and fortunately, because during the investigation we ended up discovering a small tumor in the bladder that can be properly treated early on without any major complications or adverse effects on his health. That is the reason why I want to inform you today about the characteristics you should take note of regarding your urine, such as its color and other aspects like the presence or absence of foam. And they are signs that can indicate more than just your hydration. First, what is urine and what are the indications it can provide? Urine is a compound of water and substances that are eliminated from our body during the process of excretion. Our body uses water as a solvent to eliminate various salts, toxins, substances, products of our metabolism that need to be eliminated, which if accumulated in our body are toxic. What is the reason for the yellow color of urine? The yellow color of urine is caused by a pigment called urobilin, which gives it its distinct hue. This particular pigment is obtained from the degradation process of our red cells, which are also known as our red blood cells. It originates from the degradation of group M and then undergoes a complete process in the liver, which is unnecessary for you to know, and I will not provide further details here, resulting in the production of this pigment that is excreted in the urine and is referred to as urobilin. This pigment is yellow, and that is the reason why urine for the most part is what color under normal circumstances. The normal color of urine ranges from a light yellow to a darker yellow, and this already tells us a very important factor, which is hydration. We possess water and this product in our urine. In the event that I possess a smaller amount of water in my urine, the urine will turn into a more yellow color due to the higher concentration of urobilin. If I possess a greater quantity of water, the color of the urine will become less yellow, more transparent, a lighter shade of yellow, and as a result, the urine will be more diluted. The compound itself generally does not change the amount of urobilin. What changes is the amount of water. Thus, this initial aspect is related to our level of hydration and its importance. If you have been consuming a significant amount of water, if you have adequately hydrated, your body does not require to retain liquid. Then he will utilize the water from your body in order to be able to cleanse away these toxins and send them away from our body. Then the urine becomes more yellowish in color, clear and transparent. At this point, you should discontinue drinking water. Our body consumes water on a daily basis in our metabolism, and we lose water to our environment as a result of sweating and as a result of breathing on a regular basis. Then you commence to experience dehydration. The body, in order to prevent more severe problems, starts to concentrate, starts to utilize less water in the urine. And then the urine begins to have a lower water content and a higher concentration of the pigment urobilin, which is why it starts to become a more yellow and a darker yellow color. At this particular moment, your body is indicating to you that you are in need of drinking water because you are currently experiencing dehydration. Is it closed? So this is the initial aspect. The color should be a light yellow, almost transparent in appearance. This means that you are hydrated. Closed? It started to become a darker yellow. You are starting to become dehydrated. So drink water. A crucial aspect. the initial urine of the day does not count towards the total. Do you agree with this? At night, besides not drinking water, our body, in order to make us produce less urine at night so that we can have a better quality of sleep, produces an antidiuretic hormone which naturally concentrates urine even if you are hydrated. So the initial urine of the day tends to have a more yellow color compared to the subsequent ones. If you begin to observe this, you will come to the realization that the initial urine of the day is, in fact, more yellow due to the presence of a hormone that is secreted during the night in order to enhance the quality of our sleep. So now we will move on to changes in urine color that may indicate problems and when you should seek medical attention. The initial aspect that Pedro observed was the presence of red urine. Red urine can be an indication of the existence of certain problems or underlying health issues. The first one is the presence of blood, obviously. The technical name for this is hematuria, which is the presence of blood in the urine. The presence of blood in the urine can be due to various problems, and one of these problems is tumors. These tumors can originate from either the kidney or the bladder. Renal tumors, as well as bladder tumors, possess the capability to cause bleeding in the urine, leading to the urine being stained with blood and consequently appearing red in color. It is a very important aspect. Usually these tumors, as the blood is there inside the urinary tract, it eliminates with small pieces of clots, of bruised blood. So, a very important characteristic of urinary tract tumors is that this bleeding in the urine ends up coming out with small amounts of clots. Another factor that contributes to the occurrence of bleeding in the urine is the presence of underlying kidney problems. There are infections, inflammations, kidney problems that lead to the presence of blood in the urine, which should not occur during the filtering process, causing it to start passing through. The color of this urine will appear more reddish due to the presence of hematuria, which is a condition characterized by the presence of red blood cells in the urine. Another condition that can cause urine to turn red due to the presence of blood is urinary tract infections. Urinary infections result in an inflammatory process throughout the urothelium, which is the skin lining the bladder and the entire urinary tract that we refer to as. When you experience inflammation, that tissue, that skin, it becomes more delicate and prone to damage. You know when you have a throat infection and you look in the mirror and it's very red? This is due to the inflammatory process. This will take place in the skin located inside the bladder, ureter, and urethra of the body. And this leads to the rupture, resulting in the release of blood into the urinary tract. So the urine will become more red. But it's important to note that in these cases, besides blood, the patient will have symptoms of urinary infection, like burning during urination, the feeling of incomplete bladder emptying. Therefore, the presence of blood plus symptoms of pain usually refers to infection problems. Furthermore, engaging in strenuous physical exercises can also result in the occurrence of bleeding in the urine. When you do a very extensive physical exercise, usually beyond your usual capacities, you can release the muscle, releasing into the blood a pigment called myoglobin, which will pass to the kidney and be filtered and eliminated in the urine, leaving the urine with a red appearance. If you have done an extensive run and urinated blood the next day, it is likely due to the muscle injury that occurred. Agreed? Another thing that can make urine red is some pigments that are present in food, especially beets. Beetroot, when consumed in excess, can release some pigments that go into the bloodstream, which will be filtered and eliminated in the urine and will make the urine a little redder. This is not blood, it is simply the pigment. The same pigment that makes beets purple red will also make your urine redder. And there are certain medications that can also cause urine to appear red. Here, one of the most frequently prescribed medications for this purpose is sulfasalazine, which is commonly used to treat inflammatory bowel diseases. This medication can also turn urine red. Agreed? Doctor, I urinated red. Should I see a doctor? In the vast majority of cases, yes, unless you have eaten beets or not. I consumed 2 glasses of beet juice and had red urine, possibly due to the beetroot. If you have symptoms of urinary infection and red urine, it's important to seek medical attention for proper treatment. I have nothing. I started urinating red, small amounts of clot came out. We need to investigate what is happening. So indeed, whenever you experience red urine, it is advisable to consult a physician, preferably a nephrologist or a urologist, in order to determine the cause of this condition. Another modification that can potentially occur in your urine is the presence of brown or even black urine. We use the term coluria to describe the presence of excess bilirubin pigments in our urine. Coluria indicates an abnormally high level of bilirubin, leading to the discoloration of urine. This generally tends to occur as a result of liver problems, that is, issues pertaining to the liver itself. The organ that is responsible for the metabolism of bilirubin is the liver. If there is a problem in the liver, it will lead to a problem in the metabolism of this pigment. He will initiate the process of accumulation in our body, resulting in our body turning more yellow, a condition we commonly refer to as jaundice. And this pigment starts to accumulate so much in our body that it begins to be eliminated through urine. As a result, this process gives a brownish, almost black appearance to the urine. The name of this is coluria. Agreed? It is very common. Occasionally, it is very interesting to note that occasionally patients who have coluria also have a change in their stools, referred to as fecal acolia. The yellow pigment in urine, which we call urobilin, is also present in our feces. And then he calls it stercobilinogen. There he gives the brown aspect of our feces. When it starts to accumulate in our body, sometimes the elimination of bile is compromised in our intestine. So you still stop having pigment in your stool and the stool comes out white. So usually you have these 2 associated symptoms. The coluria, which indicates the presence of brown urine, is associated with fecal cholia, which indicates the presence of whitish stools. This generally refers to problems with the liver, so yes, it is necessary for you to seek medical attention so that this alteration can be thoroughly investigated and effectively treated by a qualified doctor. And now urine can also turn green. It is less common for this to occur because the physiological conditions in our body that lead to this are relatively rare. One of them is medication. We have some medications that release some pigments that will change the color of urine. However, at times we come across patients who take supplements, and the excess of vitamin B12 in our body can lead to the urine turning green in color. Furthermore, there are specific urinary infections caused by certain bacteria that, during the metabolism of the bacteria, make use of some components of the urine, metabolize certain components of the urine, which in turn transform the pigments into a distinctive green pigment. Urine turns green. If taking medication and urine is green, it's probably related to the medication being taken. Now, if you're not taking anything, not even supplementation, and your urine turned green, I suggest you see a doctor because it's probably related to the infection I just mentioned to you. And another significant change, which many patients are scared of, is the occurrence of foamy urine, a symptom that can be concerning. Here, it's always important for us to emphasize that the foam in the urine is actually a foam that resembles soap in the urine, alright? And the primary factor that can potentially lead to this is the presence of protein in our urine. In our urine, typically, there is no protein. Our kidney does not permit passage. During the blood filtration process, does not allow proteins to pass into our urine. The big question is that due to some kidney problems, due to some problems in the filtering process, some injuries can occur both from diseases such as hypertension, such as diabetes, such as inflammatory processes that can affect the kidney. The barrier that prevents the protein from passing is damaged and no longer present. It has been lost. And then the presence of protein in the urine initiates, which we refer to as proteinuria. and then the urine begins to turn foamy. Other causes of foam in urine are usually related to a very fast urinary flow. That is, if you take even tap water and throw it with pressure in some place, it will foam. This happens in your urine, so if you urinate with a lot of pressure straining, it will end up making more foam. And at times, the presence of certain chemicals utilized in the cleaning of pots that are in surplus, that are excessively abundant, the urine ultimately reacts with these substances and results in foaming, which is not necessarily causative, but rather indicative of a potential renal issue. What I recommend if you had an isolated episode was in small quantity, observe. Now, if you are experiencing a lot of foam in your urine, have changed the toilet, seen that there are no chemical products, are urinating correctly and still producing a lot of foam, then I suggest that you seek either a urologist or a nephrologist to investigate this. Agreed? If you have any inquiries, you can leave them here in the comments section. Don't forget to give this video a thumbs up, subscribe to the channel, and share this video with those who require this information. Information is extremely important and information is liberating. Do you agree? I am Dr. Tiago and I will see you in the next video.